My name's Damien Munns, and today at the GoodBack Scoliosis and Back Pain Clinic we're going to be having a look at back pain. Normally I tend to focus on scoliosis, it's nice and visible, you can see the huge improvements, but we also do really high-end back pain cases here, and today we're going to be having a chat to Sue. So this is Sue.
Oh, we're doing it right away.
Yes,
now.
Straight off the bat. It's always the best way to do
Me.
these videos. Yes.
No,
Jump on you.
Well, it's very exciting because I had my first proper outing yesterday that wasn't to a doctor's surgery or a consultant or something, and I walked to the village green, and
wonderful.
I knew there were going to be lots of benches there so I could sit down if I needed to, but actually I did quite a lot of standing and talking, so I was up all day and it was like normal life again, which was absolutely fantastic. Didn't need a walking stick or anything.
Well, actually, as you're not just standing there without a walking stick, which is a huge step forward, but your body movements are no longer restricted. They're more expressive. They're not restricted. I can just see those little more expressive in it.
That's right. Well,
back alive again.
When my back was in spasm, it was like being in a very painful, tight straitjacket, which I am completely released from now.
So let's have a little look at you walking, and then we'll get on to the last.
Oh, goodness me.
There we go. Look at this. Now, Sue here, when she first arrived, was in a walking stick and hobbled in agony.
Completely hobbled, yeah.
And then I said, because I'm a little bit poor, my therapy room is yikes on the first floor up these stairs, and one by one we got up the stairs. But look at her now. So that's Sue for you. We'll have another chat with her inside.
Yes, and I'm putting equal weight on both. You know, I am walking normally now.
Yeah.
Whereas 2 weeks ago, I probably wasn't quite.
Okay, so Sue, we got you came to see GoodBack via looking for Dr Paul Sherwood.
Yes, well, I originally was treated many years ago by Paul Sherwood, and it was quite miraculous, it seemed to me, what he did, because I'd been about 6 months unable to put my right foot down, really bad sciatica and really bad muscle spasm. I went to see him and it seemed a matter of minutes, and I hopped off his bed and for the first time in 6 months could just stand normally. He explained to me it's not a miracle at all. It's a fairly fundamental mechanical thing he'd done. He'd merely released the back spasm by using EMS, electrical muscle stimulation, to release that back spasm. But in actual fact, that wasn't a permanent thing. My back muscle will have learned that behaviour and would in time think this isn't normal and slowly go back into spasm. And he said you actually need perhaps about half a dozen treatments just to retrain the muscle not to do that. And that's what he did. And then for many years after, I was back walking long distances, stretching exercises, hula hooping. I was able to keep myself very fit, and I think it was keeping the muscles toned that kept the problem away to a certain extent. But then of course about 9 months ago when I was diagnosed with cancer, followed quickly by surgery, and then months and months of very grueling chemotherapy and no exercise at all. I started off very optimistically, thinking, oh well, I'll have good days and bad days and I'll be able to do a certain amount of exercise. In reality, they gave me the full whack of chemotherapy and I didn't really want to get off the bed. So months and months of not doing any exercises and having the chemotherapy poisoning my muscles kicked off this old back problem again. And it was very frustrating for me because I knew that if I could find someone who knew the technique, who knew about Paul Sherwood and had the sort of equipment that he had, it could be switched off within minutes. But it was very, very difficult finding someone. And so I was in a great deal of pain, I think for a couple of months, really. And then one day, in desperation, I was Googling Paul Sherwood again, and I came up across an article written, in fact, by Damien's wife, which led me through to a website that introduced me to Damien, who is one of, I think, only 2 people in the UK, perhaps really using electrical muscle stimulation to release this very intense back muscle spasm. So the relief was fantastic.
So the other thing is, and when you had the first time or the second time the back problem, you'd gone to the doctor and your local GP, or you'd not bothered?
Yes, I had, because at one point I was in quite severe pain. I was sort of in tears with it, and I wasn't getting any sleep because whatever position I was in bed, I was uncomfortable. And so he did prescribe very strong painkiller, but a painkiller that I had to have other drugs with to protect me from the damage that the painkiller would cause. And it didn't really, slightly reduced it, but it's not, no drug is going to get your back out of spasm. So no, it really didn't work. So it was a huge relief to come across Damien and have, who I think 9 minutes in all, and he'd got rid of that back spasm, wasn't it?
Yeah. Now we're here. Now the other thing is, we had, just to keep you updated yourself, once while you were having a therapy, another lady had turned up, and she turned up early for the therapy, and we opened the door, and she was kneeling on all fours outside because she used too much pain to stand up, and she used too much pain to sit on the chair that's outside. And she goes, "It's okay, I'm down here, don't worry about me, it's the only comfortable position I can find." She sent me an email she's been a little bit up and down. She started finally, after a few sessions, to have, she's a bit younger than you, and the younger you are, the longer it takes to fix your back, basically, I find generally. And the doctors always tell you, once you're over 30, and it's downhill all the way in. The older you get, the easier it is to fix the back, because the back spasms aren't so tight.
Absolutely. In fact, a really strong, young, athletic man with his back in spasm, that is going to be quite a struggle to get that out.
To fix it.
Whereas a little frail old lady, especially one who hasn't been doing much exercise, it is much easier to treat.
It's complete opposite of what the doctors tell you. You're not going to get any better. It's
Absolutely.
So much easier. So as she's just recently retired, so her back muscles were a lot stronger, and she had these up and downs where she'd send me an email saying, "Oh, for the first time ever, I've had a good night's sleep." But then I woke, because I was in one position all night long, I woke up in the morning and it was sore. And then she said, "I had a really bad night because I couldn't get to sleep." And she woke up and the pain was gone, and because she was moving around all night long, so it wasn't one position. She sent me an email yesterday, and she said for the first time, she goes, "I've had a good night's sleep and woken up without pain, and for 2 nights running, and I'm now walking without the walking stick." And she wasn't so just update, but this is repeatable. You do it time and time again, and this could be in all the NHS hospitals, could be in every hospital all over the world. It's a totally different way of treating backs, and it's a totally easy way of treating backs, really repeatable, and that's what we're trying to do here.
I find it quite upsetting, actually, that there must be tens of thousands of people in the country hobbled by sciatica, walking with walking sticks, not being able to get a proper night's sleep, who could be helped by this treatment. It's very upsetting to me that it just isn't available. My frustration was I knew what treatment I needed, but I couldn't find it anywhere.
And it should be everywhere. And the other thing is, when you were chatting to the lady who was on all fours, they soon had a quick chat. And quite an interesting thing, they were talking about both being through pretty much the same thing. And the conversation was very quickly on, it wasn't the pain that was the worst thing, it was the hopelessness and the depression that this is it for the rest of life.
As well, yes. You can't see a way out of it at all. Except I could slightly, because I knew there was a treatment that could do it, but without flying from the UK to the States or something. I couldn't see how I could get that treatment. In fact, I was told by one physiotherapist that EMS isn't particularly approved of in this country. And I thought, what a dreadful thing to say when that could put so many people out.
Just a simple...
Because what actually happens, I think, the EMS releases the back muscle spasm, which allows the normal blood flow and lymphatic system to work, so the body can then start to heal itself, which it can't if it's in that tight spasm.
Yeah, absolutely right. I mean, the face is very good at clearing very good drainage, and I've had patients come in and they've been in a road accident 10 years ago, and they'll show me on their phone a picture of what looks like the planet Mars. And then they go, that's my face the night of the accident, and there's nothing, it's all bruised, and then they flip through the phone sort of one by one, and over the matter of days you start to see a face appear, and after 2 weeks there's a little scar and there's a whole face back, and their back is as raw sore as their face was on day one. The skin's got a bit better, but you touch it, it's sore all over. You get the drainage to work in the back like the drainage naturally works on the face, and the improvements are as good as the face over a matter of a few short sessions over weeks rather than months, and certainly not years, and while you're going through that, it's getting better day by day by day. So yeah, this should be out there for everybody. So let's get on with the therapy. Lovely to chat to you. It's so nice. Every time you see you, you're just walking so much better. It's just, I get goose pimples.
Well, my friends can't believe it. I mean, it does seem a miracle to them, because they were coming to visit me and I was in tears. I couldn't do anything. I couldn't stand at the kitchen sink. I was having to perch and so on and so forth. And then suddenly they see me the old Sue again, which seemed very instant to them. Yes.
And they wondering if that was ever going to happen again.
Yeah.
It's wonderful.
Without having any surgery.
No surgery, not a knife anywhere inside. One of them was hoping actually to have a quick chat also. He's not here today. The taxi driver who first brought you down. And what I wanted to say to him, he must have taken 1,000 people to 1,000 therapies and seen them come out. You could see his eyes almost pop out of his head as he saw you hobble in and then walk out. It's like, never seen that in my life before. He's not here today to do that, but that's his eyes were saying.
No, but he couldn't stop talking about it.
Wonderful. Right, okay, thank you very much. Perfect.